everyone. My name is Mike Casarona, and today I'm going to talk to you about artificial intelligence use in combating the COVID-19 pandemic. Today, I'll begin by giving you an overview of the COVID-19 pandemic, as well as artificial intelligence, more commonly referred to as AI. Then, I'll talk to you about AI's uses in sorting through scientific articles and data, diagnosing illnesses, identifying drug treatments, working to find a vaccine, and AI's overall funding regarding COVID-19. Then I'll draw some conclusions on the information based on my research in this topic. Then at the end, I'll be happy to answer any questions you may have. In March 2020, the SARS-CoV-2 virus, more commonly known as COVID-19, was declared a global pandemic by the World Health Organization. Immediately, countries around the world started trying to find solutions to the pandemic, such as medicine to treat the sick and vaccinations to stop people from getting sick entirely. But this all takes time to research, develop, and test. Sometimes it takes months to develop an effective medicine, or even several years to make a working vaccine. This is where artificial intelligence comes in. AI is a type of computer program that's meant to mimic human actions and behaviors, and get more accurate with more information provided. Very similar to a human, right? Therefore, AI has been a powerful tool used by scientists and doctors to help solve these problems quickly, efficiently, and with great accuracy. One task that scientists face is searching through incredibly large databases and sifting through loads of scientific articles to find information that is relevant to what the scientist is working on. I mean, it's a lot of effort just to find the one or two useful articles that are relevant to what the researcher is doing, which ends up taking time away from doing new research. And in a global pandemic, time equals lost lives. AI software is very detail-oriented and has the ability to process large amounts of both qualitative and quantitative data in a fashion that completely outweighs human capabilities. This means that AI can not only go through and find the best articles for scientists quickly and efficiently, but it may also catch information that a human would have missed, such as useful data or research hidden in a seemingly irrelevant article. A study done by Amelia Tenthworth shows that on average, scientists spend about 23% of their time searching for relevant information regarding what they're working on. That's pretty crazy. I mean, think about it. That's almost a quarter of their time just to find relevant information. To put that into perspective, that's roughly 10 hours of research a week, just so they could start working on their next step in the lab. The graph below shows how a single AI program called COVID Scholar is finding and organizing up to 250 COVID-19 related articles every day to help scientists be more efficient. AI is also really good at comparing things, and because of that, scientists have spent years thinking of how great it would be for diagnosing patients by comparing their symptoms to that of known ailments, even factoring in things like area and season to determine the most likely issue. This idea has been played with for years by sites like WebMD, whose symptom checker allows you to enter your symptoms, as well as other general information, and get a baseline diagnosis and recommendation if you need to see a doctor or not. But since the pandemic started, multiple of these online softwares have popped up, even one provided by the CDC. The goals for these diagnostic tools are to diagnose as many patients online as possible to keep them out of the doctor's office, where they'd be more likely to catch COVID-19 or infect others, and to take some stress off the doctors by weeding out patients that only have mild symptoms and prioritizing patients that are very sick and needs to be seen immediately. With dozens of different programs created by different companies, different developers, and with different information, each of these diagnostic tools are known to vary slightly, with some suggesting that you are or aren't sick or you do or don't need to go to the doctor, based on the same set of ailments. But with the scale of the tool being increased significantly in just a few months, the results are still reasonably accurate, and if nothing else, provide a baseline for the doctors to work off of. That being said, like any AI, the more information it collects, the better the results are. And then the doctors review it, and the programmers update their software, the tool progressively becomes more and more accurate, further assisting doctors in the future. Successfully and consistently treating a virus is no easy feat. It takes time and research to find the right drug that could kill or treat a virus. Making it even harder for doctors and scientists, treating a virus is not normally just one drug, but a combination of multiple drugs. But in a pandemic, time is equal to lost lives, so the faster and efficient treatment can be found, the better. To solve this issue, AI has been implemented to comb through thousands of possible drug combinations, eliminating the ones that are unlikely to work and prioritizing the ones with the highest probability of success, which the scientists can then do more research on. The image to the right is from the article Artificial Intelligence in COVID-19 Drug Repurposing. It shows the AI-assisted model used by scientists for repurposing known drugs to treat COVID-19. In other words, it depicts the structure for COVID-19 virus, as well as RNA strands and what drugs are known to target what areas. According to the article, Artificial Intelligence in COVID-19 Drug Repurposing, our current ability to find working drug combinations is only hindered by the insanely large number of possibilities. But by using network-based methodology, an advanced AI program, 51 scientists were able to identify 3 drug combinations that were likely to be effective for treating COVID-19. These combinations were based on a theoretical analysis done by the AI, and then were researched and tested by the scientists. In so many words, the AI software was able to narrow the field of research from thousands of drug combinations down to a manageable and testable 3 combinations, much faster than any human would have been able to, which got these drugs to the doctors and hospitals much faster and no doubt saved lives. One of the most coveted projects is finding a vaccine for COVID-19. Creating a vaccine is usually a very long and very hard task that's known to take up to 10 years to create from scratch. But with COVID-19, we've seen 3 major companies each produce a viable vaccine for the virus in roughly a year's time: Johnson & Johnson, Moderna, and Pfizer. And with this quick production, a lot of people are questioning how well it works or if any corners were cut. You'll even hear people say stuff like, "Hey, it's funny how we're raised not to be peer pressured into taking experimental drugs, and now we're being peer pressured into taking experimental drugs." But in all seriousness, developing an effective vaccine within a year's time is incredible, and this accomplishment couldn't have been done without the help of AI. With the thousands of things that could go into a vaccine to make it effective, and with no adverse reactions or side effects, it takes a lot of sorting through options and running simulations, which, as I mentioned before, AI is really good at doing. Similarly to how AI was used to prioritize the most likely drug combinations, having AI prioritize what is likely to work in a vaccine and eliminate what is unlikely to work based on parameters and simulations tremendously quickens the process, giving scientists more time for testing and working on the most viable solutions. Since the start of COVID-19, AI has incredible advancements and an array of new applications. And because of that, the amount of money going into AI has significantly spiked. According to Gil Press from Forbes.com, 285 AI companies based in the United States accumulated astounding $6.9 billion in the first quarter of 2020 alone, whereas in 2019, the total funding for the whole year was only $19.89 billion, and that was split between 1,509 companies. In other words, there's a projected $2 billion increase in AI funding per quarter. That's an $8 billion jump in 1 year, and split between a fifth of the number of companies. That's incredible. Furthermore, Press also states that the US AI companies grossed nearly $40 billion in 2020, which is equivalent to 56% of global AI earnings between 2015 and 2019. I mean, that's just amazing, making half of what was made in 4 years in just a single year. With all this new funding going into AI, companies have access to more resources to increase the outreach of AI and to expand on existing AI abilities. And as we're currently seeing, this funding is definitely being put to good use. Scientists have gathered evidence that shows AI has incredible capabilities in the real world. Through its continued successes in helping scientists identify articles and information, predicting high-risk areas, identifying possible drug treatments, identifying possible vaccine solutions, and much more. Even in areas where the technology can be improved, such as the online diagnostic programs, the more the AI is used, the more it will learn and the more accurate it'll get. With the amazing successes and advancements scientists are achieving with the use of AI, there should be no doubt about its continued implementation in every possible capacity to help combat COVID-19, as well as any future virus or disease. To recap, I gave an overview of the COVID-19 pandemic as well as artificial intelligence. Then I spoke about AI's uses in sorting through scientific articles and data, diagnosing illnesses, identifying drug treatments, working to find a vaccine, and AI's overall funding. Finally, I drew conclusions to summarize the information provided in the presentation based on the research I've done into this topic. I would like to thank Dr. Hayes for reviewing my work and for helping me improve my research and writing, making both my presentation and paper stronger and more impactful. I would also like to thank my peers at Kean University for reviewing my work and giving me valuable feedback on how to improve my work. Finally, I'd like to thank Monster Energy for getting me through the late nights of work and research. Thank you very much for your attention, and at this time, if anyone has any questions, I'd be happy to answer them.